CDC did loosen some of its COVID-19 recommendations today and will no longer advise people to quarantine at home if they've been exposed to COVID-19. Here to answer your questions about that is Dr. Kristen Moffatt, an infectious disease specialist at Boston Children's Hospital. We always love to see you, doctor. Thank you for being here.
Sure, good to see you.
Yeah, back to school, going to be different this year. The CDC dropping the 6-foot rule. Most students will be back to class without face masks. They won't have to participate in pool testing. Are you comfortable with all of these changes happening?
In general, I am comfortable with these changes, particularly in communities where transmission levels and hospitalization levels are not high. And that's really because this time last year, it was really only adolescents over the age of 12 who'd had the chance to be immunized. And now everyone over the age of 6 months has the opportunity to be immunized. And we know that being immunized not only can decrease the likelihood of becoming infected, but more importantly, substantially reduces the likelihood of a severe infection. And that's really what's key to keeping our teachers, our students safe, and to keeping our communities and hospitals able to continue to function even with ongoing SARS-CoV-2 transmission.
Doctor, are there any specific age groups that you're worried about?
Yeah, I am a bit worried because there's such a low vaccine uptake rate so far in the 0 to 4. It's only about 12% here in Massachusetts. We've got very good coverage for the primary series in those over the age of 12, and about 60% coverage for those 5 to 11. But we know that pediatric hospitalizations from COVID-19 do happen, and in the last few weeks, they've actually been happening at about 5 times the rate in little ones under 4 than they have been even in older children. So I would like to see the immunization rates in the very young pick up.
I want to ask you about this here because I think a lot of people were like, what? About this polio scare in London. The virus we know is very contagious. Health officials there say they've discovered it in several sewage samples. What's the risk to kids?
Yeah, I think it is important here to clarify that this really started with one case of polio-associated paralysis in an unvaccinated adult here in New York a few weeks ago. And now, indeed, polio material has been detected in London wastewater. So they are responding with vaccine really to cover communities that have otherwise low vaccine coverage rates, because that's really the key here. Vaccination is very protective against polio, and it's really communities where there's low vaccine coverage, low vaccine rates, that this would be of concern. This should not be of concern to children who have remained up to date on their immunizations, including being fully immunized against polio.
Right, so what you just said, most kids receive their 4th dose of the polio vaccine by the age of 6. So how much protection do those shots offer?
Excellent protection. We have decades of experience using this vaccine, and its effectiveness is really well demonstrated by the fact that there has not been a case of polio that started in the U.S. since 1979. So these are very effective vaccines. I would really encourage anyone whose child is not up to date on their routine immunizations to make sure that they do so.
Yeah, absolutely. Dr. Moffatt, we always appreciate your time and your insight.
Thank you, doctor. Stay well.